Well, you're most welcome to today's talk. It's Saturday the 25th of June. Now, there's a major surge of this Omicron BA4, probably mostly BA5 going on in the United Kingdom, the United States, all over Europe and Australia, and I'm pretty sure New Zealand as well. So that's interesting. We're going to look at that. And also the flu cases, influenza A particularly, in Australia are above normal. And a lot of people seem to be getting sick with that. Now, the problem with that is, well, it's bad for Australia, but of course it's their winter now, and we tend to get the same viruses next winter in the northern hemisphere. So this does give me some concerns for a bad flu infection next winter in the northern hemisphere. And what we don't want is COVID and flu infection at the same time. We really don't want that. So some quite interesting things to look at, and some pretty interesting data as well, actually. So we're definitely in a third distinct Omicron wave now. This is now clearly identifiable as an extra Omicron wave. Now, first piece of data I want to give you is from this government website here. Obviously, I've given you the link. Do check it out, and you can download these full technical briefings, which, to be fair, are actually quite accessible. They're not written in jargon. You can actually read them if you're prepared to spend 20 minutes, half an hour going through it. BA5 growing 35% faster than Omicron subvariant BA2, which grew faster than Delta, which grew faster than Alpha, which grew faster than the wild type. This is getting more and more transmissible. So it's growing faster. Now, to be fair, the fact that it's growing faster doesn't mean it's necessarily more transmissible, because a lot of this is a result of immune escape, because it's infecting people that have already been infected, basically. It's just an evolutionary principle. It's occupying any ecological niches it can, and unfortunately that often happens to be us. But certainly growing faster. BA4, that should be BA4, sorry, apologies. Growing 19% faster. So BA5 is growing the fastest, then BA4. So BA5, although these two are going together because they have a growth advantage over BA2, BA5 should gradually become more predominant than BA4, which is slightly less transmissible. Now, what's going on in the United States, first of all? Let's look at that. So here we have some CDC data. Now, it's always hard to tell what's going on in the States, because the surveillance is nothing like as good as it is in the United Kingdom. We know a lot about what's going on in the world from the UK surveillance data, but we do see that hospitalizations are starting to increase in the States. So definite increase in hospitalizations in the States, 1.5%, but it is becoming a bit of a, we can see it's becoming a bit of a trend there. Do click on that data for yourself. Now, the United States hospitalisation data is quite essential because we don't have the widespread infection data as we do in the UK, as we said. So increasing hospital patients is probably our best proxy, going up somewhat. The other one that's useful is test positivity. So not the number of tests, because we know the number of tests is very poor, but the test positivity, the percentage of tests coming back positive, is useful, because that's presumably more representative than the actual number of tests. Now, of course, the number of tests being done aren't necessarily a representative sample, so this is not good science, but it's a good indicator. Test positivity is about 14%, and I've just got a graphic of that here. So here's the test positivity in the United States. So this is way back at the start. This is the original Omicron wave here, very high test positivity. And now we know that's gone up to, what did we say it was, 14, did we say 14%? So it's gone up to about 14% now in terms of test positivity. So that means to me that BA4, BA5 particularly are going through the States at quite a rapid rate. And we know that from other data as well. Now, this is the reference for the UK hospital data, which is another one that we need to look at just to demonstrate this increasing BA4-5 large-scale wave. Now, if we look at the overall situation in the UK here, Testing positive, okay, we know that's not particularly reliable. Deaths, deaths in the last 7 days, 731. So although it's up slightly, I don't think we can attribute too much to that because the numbers are low. But patients in hospital are definitely going up. And if we look at healthcare, live data from the UK, patients, so this is patients admitted to hospital. In the last 3 months, we are getting a small increase. This is not because BA4, BA5 are very pathogenic, more so than other Omicrons. They appear almost certainly not to be, but it's just so transmissible. There's so many cases that a small percentage, unfortunately, will have problems. Patients in hospital, again, obviously, in the last month, we do see a slight increase. Good news, though, patients in mechanical ventilation, here's the position for the year. We know it went down as soon, this is when Omicron started, this kind of time, and then it just went down with Omicron. Really good news. Slight increase there, probably with the BA2, but we don't really see a significant increase, thankfully. Very small, but we do know that the majority of people actually admitted to intensive care situations are with Omicron, not for Omicron. Hospitalisations, the majority are for Omicron, but intensive care, the majority are with Omicron. Now, I want to look at Australia now because, this is quite a bit concerned about this, really. First of all, Professor Adrian Easterman, he's a numbers guy, but he seems to be on top of this, so that's why I'm quoting him. Basically, all those subvariants, Omicron subvariants, are all in Australia at the moment, and they're competing with each other. Of course, exactly as we've seen in the United States, in the UK, BA4, 5, well and truly now established in Australia, and will take over. No question about that. At the moment, this is as of yesterday, BA2 is the majority of cases in Australia, but BA5 is starting to take over. BA4 as well, but BA5 particularly, which seems to be the more transmissible. So an ongoing situation in Australia there, like the UK, because there's a lot of immunity from vaccinations and from previous infections. The number of hospitalisations directly from that should be reasonably small, but this is the next data set I want to give you. Australian influenza surveillance report. Now, bear in mind it is in the middle now. It's the peak influenza season in Australia now, exactly where we will be in 6 months' time. Obviously, their winter's the wrong way round. So 147,000 official notifications so far this influenza season, as we say, into the peak of it now. But it'll go on for quite some time. 55,000 cases in the past 2 weeks. Most of these are influenza A. Now, influenza A is the sort of the form that spreads. So this is the form that we will get. So the influenza that's in Australia now, we can say with a degree of certainty, I'm afraid, will be in the United Kingdom and the United States for next winter. And the other thing that's concerning, well, it's always never good news. The H1N1 was only 0.8%, but the H1N1, of course, is the one that caused the pandemic in 1918, 1919. So we really don't want too much of that, but hopefully small at the moment. Looks like it's being outcompeted by the other influenza variants. A and B co-infections, we don't want that either, but they're very small. And highest notification rates are in children. And the reason that this is concerning, these are just numbers, but this is quite a bit higher than the 5-year average for Australia. So they're having more influenza in Australia than the average over the past 5 years, as you would expect, because during the lockdown situations, people weren't getting exposed to influenza, therefore they weren't developing the immunity. So the influenza is catching up. And highest notification rates in children, which is bad. Now, influenza, people tend to say, oh, I've got a bit of flu. If they're saying, oh, I've got a bit of flu, almost certainly they haven't. If you've got influenza and it's a strain you're not resistant to, you are so sick. I mean, I remember the last time I had it really bad was about 1992. And I remember lying on this floor in this room, actually, And I had a bed in here then, and I remember thinking, I can't get into bed. I was lying on the floor, I can't get into bed. And I lay there for an hour or two, and I remember thinking, well, if I die now, that's fine. I felt so sick. This is, proper influenza is not a trivial disease. Now, thankfully, the sequelae from it aren't great. People do tend to make a good recovery. But at the time, you feel so sick. And it can take you a good few weeks to start feeling better as well. What we might call long influenza, it can take a good few weeks to recover. And of course, there can be sequelae, but thankfully most people make a good recovery. But you're so ill, it's just horrible. Now, so that's a concern for next winter. We'll keep an eye on that. Zoe data. Moving on to the Zoe data now. Here we have the latest Zoe data, and we can see that it's going up quite steeply. The figures are going up quite dramatically. So that was basically BA1, that was BA2, and now this is BA4-5. So we do see a succinct wave. 250,000 new symptomatic cases being added to that per day. So here's the graphic for the increase in the Zoe cases, and you can see that the dots are getting further apart, indicating that it's an increase, and this will go on because of the immune escape of BA4-5. Whether it becomes a curve of this size or not, we don't know yet. In terms of mildly symptomatic cases, which most of these thankfully are, it's quite possible. But thankfully, most aren't being hospitalised, as we saw. So data from this is data now from Tim Spector's report. Do check out Professor Spector for yourself. Always completely data driven. Tim just does the data, no messing about. It's proper science. Love it. So anyway, new COVID wave, as we said, getting on for 250,000 new cases per day, up 40% on the week. So this was actually about 2-3 days ago, this data, 225,000 new cases. As we see now, it's a bit higher, up 40% on the week, dramatic increase. Prevalence in the UK is now 1 in 27. Scotland is 1 in 18. Why is it high in Scotland? We don't know. But it is. 1 in 18 symptomatic. That gives a UK R value of 1.1. Mostly the BA5 surge, to some extent BA4, but mostly BA5. Now, Professor Spector's data is saying that BA5 and BA2 are both basically equally transmissible. The reason that BA5 is taking over is because of reinfections. It's able to occupy the ecological niche of people that have already been infected with Omicron. So there's a lot of reinfections, and reinfections after previous strains, and also reinfections, of course, or infections after vaccination. So a lot of immune escape is why the BA4, BA5 is transmitting, as we said, about 33% more quickly than BA2 did. So huge immune escape, evolution, viral evolution acting before your eyes. More reinfections from this year and last, so a lot of reinfections. No increase in deaths. Deaths a little down on the week, which is good. Hospitalisations are up just because of the sheer numbers. So for any individual, the risk is less, but because of the sheer numbers, the hospitalisations are up. So BA5 causing less severe disease in all probability, but because we've got 1.7 million of us at the moment currently infected. In fact, that was last week's figure. It's probably 2 million this week. There is a small proportion being hospitalised, unfortunately. Increasing in all age groups, increasing in all regions. I think the northeast isn't quite as bad, but apart from that, it's increasing everywhere. Now, long COVID. This works out at 3,851 people who are going to have who are developing symptoms today, whose symptoms could last 3 months. So this is a big chunk out of the workforce. People could be not back to normal for at least 3 months. And of course, we know a proportion of those for even longer. Omicron, less likelihood of long COVID compared to Delta. So there's less long COVID with Omicron, but we've got so much Omicron. That still comes out at 3,851 people who today are starting on a 3-month course of not being 100% at all. More cases overall due to the sheer number of infections. Now, again, the King's College team have calculated risk of getting long COVID with BA1 is currently 1 in 23 infections. Now, what is it with BA2? What is it with BA5, which we have a lot of now? We don't know. I haven't got enough data on that yet because the time hasn't passed. But basically, 1 in 23 people who got BA1 had symptoms for more than a month. Okay, we could debate whether you call that long COVID, but it means you're knocked off for a good month. This is a long time. Multiplied by several million, of course, many millions throughout the country. Right, ONS data. I'm just going to refer to this briefly. Do check this out for yourself. The ONS site is quite brilliant, apart from the fact that it doesn't report on antibodies for natural infection. Now, I've just given feedback to the Office for National Statistics again today. My last feedback they didn't act on. Let's hope they act on today's. ONS, if you're watching, data please on natural infection antibodies. It would be so easy to do it because you're already collecting data on antibodies altogether. Just differentiate. For example, just check the nucleoplasmid antibody. So simple to do. Please do that. Anyway, ONS data here. Now let's just look at some of the main points here. 1 in 40 people in England infected, 1.36 million. Wales 1 in 45, Northern Ireland 1 in 30, Scotland higher 1 in 20. It's now higher. Remember, Tim Inspector said it's 1 in 18, but this was this data slightly out of date, always is with the Office of National Statistics. London highest incidence highest prevalence. Incidence is new cases, prevalence is current cases. 25 to 30-year-olds who are the most sociable, of course. Whereas when you get to my age, I can't really be bothered socialising. So the prevalence in my age group is slightly lower. But it is increasing in all age groups. And the age group that seems to be particularly being affected in terms of getting ill with Omicron is the much older age group. It's the over 85s that are getting mostly affected. That data we looked at from the United States, that was over 70s. So it doesn't differentiate that well. But in the UK, we know it's the over 85s that are being hospitalised particularly. Antibody data, well, basically, I can't remember what it is, but it's about 99.3% have got antibodies. Basically, virtually everyone in the country has been exposed. Secondary school pupils, it's 96.6. Primary school pupils, the data from the ONS is only 62.4. I'm just wondering if it's waning more quickly in younger children, if the antibodies are waning more quickly. Don't really know that. It may or may not be the case. But it would explain why the numbers are so much lower in young people, because it's hard to see that they'd have less infection. Now, just a few quick pictures from the ONS. Here we see the increase in cases in England. Remember, the ONS is not based on NHS reporting. It's based on completely independent surveys. So this is good quality data. We can say that this is accurate, certainly the most accurate thing we've got, because it's based on survey data. From that, they can extrapolate to the whole population with high degrees of accuracy. So that's the situation in England. Scotland, we know cases are slightly higher. Why it's increasing more quickly in Scotland, we don't know, but a definite increase there could well be going up into the levels of the original Omicron wave here. Now, this is particularly interesting here. Now, the blue line is compatible with BA1, BA4 and BA5. Now, we know that BA1, basically we haven't got any more, because the BA2 outcompeted the BA1, and now the BA4 and 5 are outcompeting the BA2, and the BA5 seems to be outcompeting the BA4. And yeah, it's not funny. I don't know why I'm sniggering at that. but here, let me look at this graph again. But the point is that this is compatible with BA1, BA4 and BA5. That's right, that's what I was saying. So the BA1's not there anymore. So we know that this blue line is now virtually all BA4, BA5. And we can see that that's outcompeting the BA2. So the majority of cases now in England are BA4, BA5 as the BA2 goes down. And this is just the way the PCR tests work, detecting particular amino acid sequences. Again, BA5 here in Wales outcompeting BA2. And then the final one we'll show today is Northern Ireland. Again, we see the same situation with the BA4-5 outcompeting the BA2. And in Scotland, we see the same situation with the BA4-5, particularly the BA5 outcompeting the BA2. And we can assume that the situation is remarkably similar in the United States and Australia. It's just that we have good data from the UK. So there we go, we're heading into another wave. As time goes on, numbers are going up, but the gap between numbers and hospitalisations is getting wider. So at first hospitalisations were closely tracking infections. Now there's lots of infections resulting in lower numbers in terms of proportion, in terms of percentage of infections in hospitalisations. But hospitalisations are going up because of the sheer numbers of infections. Thankfully not going up too much. I'm just going to finish with, give the last word to Dr. Walensky. I don't know why I'm laughing today. Sorry. Be serious. It is a serious matter. Actually, no, this is a very serious matter. Childhood vaccinations. We've talked about it many times. Dr. Rochelle Walensky, Moderna, recommended a second safe and effective vaccine for children aged 6 through to 17 years. So having allowed the Pfizer for over 6 months, she's now brought, or the CDC have now brought the Moderna down to ages 6 years to 17 as well. And remember, this vaccine is still based on the original Wuhan strain. And we've seen the amount of immune escape to that. So has the risk-benefit analysis changed? Yeah, I think it's changed. How effective will this original Wuhan strain virus be against Omicron infection? Not very. I've just demonstrated that really conclusively from the UK data. We're seeing massive breakthrough infections, and yet this is the current recommendations, which I'll leave you to ponder on yourself. So a lot of data today. That's the way things are going, and thank you for watching.